Good afternoon, everyone. Thanks so much for joining. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here to give a COVID update and also talk about Protect Your Health on the 12th and a lot of the ways that many city agencies are stepping up to make sure families and children have support on that day, that we're doing everything we can as a city to raise vaccine awareness. So I'm joined today by Pedro Martinez, the CEO for Chicago Public Schools, Rosa Escareno, the Interim Commissioner at the Chicago Park District, Rebecca Estrada, the Deputy Commissioner of Youth Services for the Department of Family and Support Services, Juan Salgado, the Chancellor at City Colleges of Chicago, Elizabeth Todd Breland, a Chicago Board of Education member and a CPS parent, and Dr. Geraldine Luna, Medical Director at CDPH. I'll first give a quick overview of where we are as a city with COVID. So as of today, Arkansas is off our travel advisory. You can see that most states across the country continue to see more than 15 cases per 100,000 per day for people who are unvaccinated and wanting to travel. You need to quarantine upon return. You need to get tested. If you are fully vaccinated, and that applies for children and adults, the travel advisory does not apply. If we look at the country overall, really the Northwest and the Plains are having the most issues. We're also seeing increases across the Midwest. We have passed more than 750,000 COVID deaths across the country and more than 46 million cases. Chicago continues to average about half the average daily case rate, 12 cases per 100,000 compared to 22, the national average. Similarly, when we look at hospitalizations, there too, we're averaging about half the national average, where across the country, we've got 15 people hospitalized with COVID per 100,000 people. Here in Chicago, we're at 8. And again, you can see really the Great Plains area is having the most trouble right at the moment. But if we look at the Midwest, I don't know. If we look at the Midwest, and we'll post these slides online so you can see the details. Every one of the states around Illinois is now on the increase when it comes to COVID numbers. Illinois itself has started to have a slight increase, as has Chicago, which we'll talk about, but that's also true for Indiana, Iowa, Michigan, Minnesota. That started approximately October 24th, and then as the weeks have gone on, we've seen that spread, including here to Chicago. Some of that is as the weather is getting colder and we're moving inside. For me, it's especially an indication that now is the time to get vaccinated if you haven't yet, and to make sure your kids are getting vaccinated. So where we look at where we are in Chicago as a city, we are now averaging 382 cases of COVID every day. That is up 22% from a week ago. We're getting closer back to that 400 cases per day mark. That would put us back into a high transmission state. Our test positivity is good at 2%, but it is up from 1.7% a week ago. We still have adequate capacity for both non-ICU and ICU beds, but both of those are also on the increase. Where we look at our case rate overall, at 382 cases per day, you can see just starting to increase again. Nothing like what we saw last October, November, that huge surge where we were up to more than 3,400 cases every day. We're at 10% of that at this point, but clearly in that substantial transmission range. Our test positivity, similarly, you can see very low compared to what it has looked like cumulatively over the whole pandemic. Not seeing an increase like we saw last October and November, but clearly on the increase again, and we'll be keeping a close eye. The biggest risk factor still for being diagnosed with COVID, hospitalized with COVID, or dying from COVID here in Chicago and across the country is not being vaccinated. We share in Facebook every time a lot of detail here. Even just during Delta, unvaccinated Chicagoans have been more than twice as likely to be diagnosed with COVID as unvaccinated Chicagoans, and where we look at risks for hospitalization and death, it's 5, 7, 10, 15 times. Also, if we look at children, lots of conversation about the 5 to 11-year-olds, but we've had an opportunity to look back at the Delta surge here in Chicago and see how COVID showed up in 12 to 17-year-olds during the Delta surge. And what we saw is that just here in Chicago, just during the Delta surge, 12 to 14-year-olds who were unvaccinated were more than 10 times as likely as vaccinated 12 to 14-year-olds to be diagnosed with COVID. And here in Chicago, unvaccinated 15 to 17-year-olds were more than 7 times as likely as vaccinated 15 to 17-year-olds. That chart shows the dotted lines on the bottom are the vaccinated cases of COVID in those older children, and then the solid lines show those who have been unvaccinated. It is the most important thing to protect your family, your children, to get kids vaccinated. We still, in terms of breakthroughs, 99% of fully vaccinated Chicagoans have not tested positive for COVID-19, although we continue to see breakthrough infections every day, especially among those who are older or have underlying conditions. More than 99.9% of Chicagoans who have been vaccinated have not been hospitalized for COVID, and more than 99.99% have not died. I continue to hear people asking and thinking that the COVID vaccines are not working well because we see some breakthrough cases. They continue to work beautifully. I don't want you thinking that because there are breakthrough cases, that's a reason not to get the vaccine. My biggest worry are people who have not yet had a vaccine, not whether it's possible they could have a breakthrough infection. Right now, we're at 75.9% of Chicagoans over the age of 12 have had at least a first dose. We're getting very close to our Protect Chicago 77% goal. We've got to get about 35,000 more Chicagoans vaccinated to reach that first goal of 77%, having had a first dose for our 77 community areas. Shout out to both North Park and Avondale that reached that 77% threshold this week. You see on this map, the community areas in darkest blue have hit at least 77% have gotten the first dose. And when we look across the city, we're seeing progress in every vaccine area, every community area. We'd love to get to the point where 77% of Chicagoans have been fully vaccinated, and there citywide we're at 70%. You can see the darkest blue on this map here. We actually have relatively few community areas that have hit that 77% fully vaccinated mark, but we're making progress every day. We are seeing some increases in vaccine doses. We're back up to about 9,500 doses every day from Chicago of vaccine, and that is, down from where we were, certainly. But the fact that we're doing, again, 50, 75, 80,000 vaccines a week is about a quarter of where we were at the peak. Some of that is because of fully expanded boosters. Some of that is because children are eligible. But some of that is because we still see every day 2,000 to 3,000 Chicagoans getting their first dose of vaccine, not even including the children. For those who received a Pfizer or Moderna vaccine, I will remind you, boosters are available and strongly recommended for anybody over the age of 65 or anybody over the age of 50 with an underlying condition. They are also recommended for anybody over the age of 18 with any underlying condition or who's working in any higher risk setting. And for anybody who got a J&J vaccine, we're strongly recommending a booster 2 months later. There's lots of detail on chi.gov /covidvax if you've got more questions. As of today, we've had about 170,000 Chicagoans get their booster dose, but only 1 in 3 still of eligible seniors, meaning those over 65, have gotten a booster. If you know somebody over 65 ahead of gathering for the holidays, please, please, please encourage them to get a booster. That's who we're seeing most of the breakthroughs in. And although that's a good increase, we were only at about 26% last week, and we've jumped up a fair bit. That's not where I'd like to be. So please continue to encourage boosters. And now let's talk about the children and getting vaccinated in time for the holidays. So we've been sharing these on social media. These next few days mark the beginnings of some deadlines around getting vaccinated ahead of various holiday gatherings. Technically, this Thursday, November 11th, would mark the deadline for 2 weeks before Thanksgiving itself. So getting a J&J on that date would make you fully vaccinated in time for Thanksgiving, as well as getting the second doses. One of the reasons we've chosen Protect Your Health on the 12th is because we'd really like to encourage adults to get that first or second vaccine, but also to get the booster vaccine about 2 weeks in advance of Thanksgiving if you're going to plan to be gathering. And of course, trying to get younger children the opportunity to get at least that first dose in terms of Thanksgiving. But then over this next weekend, November 14th is the deadline for getting your second dose of Moderna or Pfizer, or your single dose of J&J in time for Hanukkah. And we're coming right up on the end of the year holidays. November 13th would be when you need to get your first dose of Moderna if you want Moderna and you want to be fully vaccinated in time for Christmas. And November 14th would be your first dose of Moderna if you want to be fully vaccinated in time for Kwanzaa. So I know it feels like the holidays are a long way away. They are not. And please, if you're planning to host people for these holidays, do everything you can to make those gatherings as safe as possible. Share these dates with people. Encourage them, especially if they're here in Chicago, to get vaccinated. Here is where children 5 to 11-year-old live in the city of Chicago. The darker blue it is, the more children there are who live in census tracts. Those red census tracts are places where there are at least 700 children between the ages of 5 and 11. There are about 210,000 children between 5 and 11. By the 12th, we will have gotten about 100,000 pediatric doses in. Vaccination has been going very well to date. We've, of course, have been paying attention to where children live, where we've been thinking about where to prioritize vaccine, as well as making sure that particularly in unvaccinated neighborhoods, there are opportunities for walk-in. There are more walk-in appointments available across the South Side than there are in any other part of the city. That is by design. We do encourage people to make appointments, though, if you're able to in advance, just to help make sure we've got vaccine available for you when you want to get it. Where to find vaccine for the 12th is going to be based on your region. We've divided the city into these regions, and you can go to vaccines.gov and put in your address and be able to see who has received pediatric vaccine, for example, around you by distance. Chi.gov/youthvax will be listing a lot of details. We've put a lot of this out, but we'll show you which pharmacies are doing pediatric-focused events. We'll let you know which schools have opportunities on that day, which community areas are available. First and foremost, please check with your pediatric provider. There are approximately 200 Chicago vaccination sites that have received that pediatric vaccine. Many of these are the best place for kids to get vaccinated because it's the opportunity to make sure they're up to date with all of their well-child needs. And our first priority is having children get vaccinated in the healthcare system. Finally, looking beyond the 12th, there will continue to be opportunities to get vaccinated. Your family health care provider, first and foremost. CPS and other school sites are going to have plenty of very focused events. Local pharmacies, which is where most Chicagoans right now are getting vaccinated, will continue to have vaccine widely available, including for children. Hospitals, the CDPH is standing up family vaccination clinics every Saturday and Sunday, going through January, except for the weekend of Thanksgiving. Protect Chicago at Home will open up for children beginning the 15th. We're going to have ongoing CDPH immunization clinics, community events, and then vaccines.gov. Lots and lots of opportunities to get your child vaccinated, but please don't wait. Get it done. If you don't do it on the 12th, get it done hopefully very soon thereafter. Lots and lots of opportunities. And so finally, for families who need to find childcare and activities during Vaccination Awareness Day, we're going to be hearing from CPS and the other leaders up here with me. But I did want to highlight that in addition to that, Shedd Aquarium and the Museum of Science and Industry are both offering free admission for students on that day. And all Chicago Public Library locations will also be open 9 to 5. Children do need to be accompanied by an adult if they're there, but they've set up grab-and-go kits with activities for kids to do in the library. They've got extra online tutoring and homework help available, and they also are very available to help people find a vaccination site. So in addition to calling 312-746-4835, we'll help sort out whatever vaccination question or access need you have. Libraries is doing that too. And with that, I'm happy to hand it over to Pedro Martinez to talk in a little bit more detail about what's happening on the 12th of November. Thank you.
Thank you, Dr. Arwady. So what you're seeing here is, so first of all, is the sites that we're going to have. These are the sites across the entire city that are going to be available. And as Dr. Awadi said, there's going to be over 200 sites, and I'm going to share a little bit of more information what's going to be available at CPS. But I can't emphasize enough how this is an investment for the rest of the school year. If there's one thing that I saw just battling COVID in my former district and former state, we saw significant uptick in cases as we got into the holidays, especially right after Christmas. You saw the dates that for children to be fully vaccinated, which means 2 weeks after the second shot, really the target date is that Friday and Saturday for our children to get vaccinated. One of the concerns that I have is that when we saw cases rise, it just leads to not only more children having cases, but also a significant number of children being quarantined. And so again, I urge our families, please take advantage of that Thursday through Sunday weekend to get your children vaccinated, especially our 5 to 11-year-olds, because we want to have a strong second semester, and I want to have stability in the classrooms. And we have always said, as we said before, what's great myself as a parent of an 11 and 5-year-old, the doses are about a third, about 30% of what they are for adults. Right now, what's great also about doing them over the weekend is if you're concerned as a parent, as I am, about symptoms, that you have that weekend so that you can monitor your children and ensure that, again, that those symptoms don't get any worse. So across the district, we will have, for example, our 4 regional clinics at Roosevelt High School, Michelle Clark, Richards High School, and CVCA. We will also have 6 mobile events at Chavez, Mitchell, Kenwood High School, Nixon. We're also confirming Hirsch and Deneen. In addition to that, we'll have 13 of our school-based clinics that will also be offering vaccines for 5 to 11-year-olds. That's at Johnson, Marine Leadership Academy, Beethoven, Davis, Drake, Inglewood STEM High School, the National Teachers Academy, Ward, Gale, Orr High School, and Simpson High School. In addition, throughout the months of November and December, we're going to have well over 100 different vaccination events. I am so grateful to our city agencies and our park district and libraries and our Department of Youth and Services. They're partnering with us so that we can provide also support for any families that need child care. But in addition to that, we are also, we also are we're partnering with our faith-based community to have over 24 safe haven sites. We're going to put this on a map on our website, but you can see the addresses here, because we know that some families need that support. And then finally, we are going to be sending all this information to parents, not only in letters and text messages. So one of the things we want to do is make sure that our parents know that we're going to support them. I know one of the questions that I've gotten in the past is, are we going to cancel classes for the second vaccine dose? And the answer is no, but let me tell you the opportunity that we have in front of us. We will know how many of our families took advantage of getting their children started on the vaccine process with this weekend coming up from the 11th through Sunday. We will work with those families, and whoever needs help with that second dose, we can either leverage our mobile clinics, we can leverage our school-based clinics, our regional sites, as well as our health partners to help families with that second dose. And so we want to make sure that as we know who those, once we know who those families are, we will reach out to them and start working with them on a plan for the second dose that won't require for me to cancel classes. And then, more importantly, I'll also know the families that have not chosen to vaccinate their children that weekend. And what I want to do is work with our health professionals, work with Dr. Awadi on doing outreach to those families, so that we can get them the information they need. Because what I can't tell right now is how many of our families, by the way, we're seeing a significant uptick in vaccines, in families getting registered for the 12 for vaccines across our city and across even our sites. But what I want to know is how many families are still on the fence, and what is it that we need to provide them for information around the safety of the vaccine. And so that's going to give us those opportunities to be able to do that. And with that, I'm going to bring up our amazing interim from Parks, Ms. Rosa Escareño.
Sorry. No, you're fine. Thank you. Good afternoon. My name is Rosa Escareño, and I'm the interim superintendent and CEO at the Chicago Park District. Again, it's my pleasure to be here with all these great leaders coming together to support families and children on their route to health and vaccination. So As Chicago Public Schools will not be holding classes in observance of Vaccination Awareness Day on Friday, November 12th, and to allow parents and guardians the opportunity to have their children vaccinated. And as always, when school is out, parks are in. So this Friday, the Chicago Park District will be hosting out-of-school time programming at 54 parks across the city. At 43 of the park locations, they will be operating from 9 a.m. to 3 p.m., offering programs to youth between the ages of 6 and 12, and they can enjoy organized activities and have supervised environments so the kids can enjoy the day there, so parents can feel free to drop them off there. We ask parents if you're going to be dropping off your children between 9 and 3 that they please pack a lunch and something to drink. We certainly are working with our partners, so where there is a need, we will make sure to supplement those meals if needed. But certainly, please plan for that. All of the programming is free. No child will be turned away, and parents can register their child or children in activities in the same way that they would normally register or sign up for Chicago Park District programs. And so while pre-registration is always recommended, certainly, again, our staff will be ready on site to ensure that we're registering the children once they arrive on site. In addition to the 43 locations I mentioned, we will also be offering additional drop-in day to play at 11 park sites, and the hours will vary at those locations, and no registration is needed for drop-in activities. Those will happen regularly throughout the day. And as a reminder, we have 600 park locations across the city for just general recreation area. The 54 locations I've mentioned, they are specifically dedicated with staff ready for children, but certainly we encourage all individuals to continue to utilize all of our 600 locations throughout the city. And so please visit our website at thechicagoparkdistrict.com/Chicago-out parks-in. And so please, we welcome you. We, as always, remain committed to keeping our children safe and looking forward to having them enjoy their time at the parks while parents are taking that time to vaccinate their children, and if they have to go to work and need a place to have their children come. And as we announced last month, the Chicago Park Districts are required to also be fully vaccinated against COVID-19. And then unless they have a medical or religious exemption, December 15th is the day for the Park District, so our policies are aligned with the city's policies. And for us, having a vaccinated workforce is our priority, and making sure that all of our facilities are also working towards that, so using this time as well to promote vaccination across our entire workforce. So again, thank you to Mayor Lori Lightfoot, our sister agencies, for being our great partners. And if you will allow me just a minute, I'll repeat it in some key details in Spanish. El viernes 12 de noviembre, el día de concentrarnos para la vacunación y asegurar que los niños tienen la vacuna, el Distrito de los Parques de Chicago ofrecerá programación en 54 parques a lo largo de la ciudad con el fin de apoyar a las familias con el cuidado de los niños. Más información sobre esos locales pueden ir a nuestro sitio de internet para obtener esos detalles. Y gracias. Y ahora, now I'd like to bring up Brandy Kanazi, or I'm sorry, Elizabeth Todd Breedland, Chicago, no. Rebecca, I'm sorry. Rebecca Estrada, Deputy Commissioner of Youth Services, Department of Family and Support Services. Sorry, Rebecca. Thank you.
Good afternoon, everyone. Thank you, Rosa Escareño. My name is Rebecca Estrada, the Deputy Commissioner of Youth Services with the Department of Family and Support Services. I am here today to talk about the importance of our communities and families getting vaccinated and support the city departments and agencies that are here today to help bring resources to our families and all Chicago residents. For the past 20 months, we have seen the impact of COVID-19 virus has caused to families, children, and youth. Last week, Mayor Lightfoot, the Chicago Public Schools, and the Chicago Department of Public Health announced the CDC's approval of the COVID-19 vaccine for 5 to 11-year-olds and the upcoming process to ensure children and unvaccinated adults can receive this life-saving vaccine. As CDPH and CPS are working to provide access to the vaccines, DFSS is committed to providing support to families and school-aged children on November 12th, Vaccine Awareness Day. DFSS is currently working and reaching out to delegate agencies to expand the hours of operation to youth-oriented and mentoring programs that are already available at many of our schools. These youth-oriented programs will provide enrichment activities and snacks for participating students. These programs will only be open to children 6 to 18 years of age and mentoring opportunities for youth 12 to 21 years of age who participate in the existing after-school programs at their school for a full day. Our delegate agencies have continued to go above and beyond to extend their hours of operation in support of Vaccine Awareness Day. Agencies such as Union League Boys and Girls Club, Carol Robertson Center for Learning, and others will be available at their school sites in offering positive, structured, and safe activities for young people. As we ensure that these opportunities for care, enrichment, and safe spaces for children and young people exist, we will also continue to offer education to parents on vaccine efficacy and safety. Now I'd like to pass it to Chancellor Juan Salgado.
Thank you. So let me start by, really hearty thanks to Commissioner Arwady, CEO Martinez, for their tremendous leadership in, bringing us this Vaccination Awareness Day for the families and children in Chicago. City Colleges is working with CPS and CDPH, our fellow agencies, as part of this comprehensive effort, and like my colleagues, are really encouraging us all to get the boosters, get the vaccine, get our children protected, get our family units protected. We're thrilled to be, as part of our efforts to contribute, to offer college tours for high school students and their families this Friday at all 7 of our city colleges. Students and their families will be able to learn more about our free early college courses for high school students, about academic pathways in high-demand fields, and about Future Ready, which offers Chicagoans the chance to take select short-term programs at no cost. And so when you're coming to our facilities, this is a family event. Okay, there's something for the adults as well, especially with this Future Ready, no-cost programs for you to be able to get your career started or advance your career. Faculty and staff are going to be on hand. We're going to answer your questions. We're going to take you around. We're going to make sure that you know that City Colleges has resources for you at this very opportune time. I also want to share that we're honored to partner with CDPH for these family vaccination sites for children 5 and up and adults. Starting on Saturday, we'll hold a series of events where families can find free pediatric COVID-19 Pfizer vaccines for children, as well as Pfizer and Johnson & Johnson vaccines and booster doses for adults. And so the whole family coming in, thanks to CDPH, at our colleges. These events will be on the weekends, on Saturday at Daly College, Sunday at Wright College. There's a full list at chi.gov website that you can tap into. And we welcome you all to please visit City Colleges of Chicago, get your vaccine at City Colleges of Chicago, and thank you in advance for doing so. I'll just say a brief few words in Spanish. Los colegios comunitarios de la ciudad de Chicago van a servir como centros de vacunación familiar. Esas fechas van a ser los sábados y domingos, comenzando este sábado 13 de noviembre y este domingo 14 de noviembre y siguiendo durante el mes de noviembre, el mes de diciembre ni los principios del mes de enero. También estamos realizando giras el mero día 12 dentro de los colegios para que las familias y los estudiantes aprendan de lo que tenemos que ofrecer para ellos en programación, incluyendo programas gratis para los que están viviendo en la ciudad de Chicago, que quieren avanzar sus carreras sin tomar en cuenta nada más que estén residentes de la ciudad de Chicago, no importa la documentación y otras barreras que puedan existir para ellos. Y con eso quiero invitar, I want to invite Elizabeth Todd Breland, a Chicago Board of Education member and CPS parent, to speak.
Thank you so much, Chancellor Salgado. I think this really powerfully speaks to what we can do when all of these sister agencies and community-based partners come together in this work. And I'm so grateful for all the different departments and groups who have come and stepped up for this moment, a moment that's so important for our city and so important for our children. Also, thank you to the community-based partners, the faith-based partners, all of the folks who are really wrapping their arms around our kids and our families right now. I am so excited about the vaccine. Since the beginning, we've been told once the vaccine was going to be available that it is the way forward, is the route forward for us and for our families. I just got my booster yesterday at a community-based clinic at Inglewood STEM High School. It was very quick, it was very easy, and my kids will be going this Friday to get their vaccines, and they're very excited as well. And I want to encourage everybody who can. I appreciate the emphasis on the timeliness of this and what it means for us to be safe over the holidays. I know there are things that everyone's looking forward to about being able to do with your children and feel secure in being out in public, going to a restaurant, going to the movies. For me, I think about visiting family who live out of state and that being a possibility, and end to quarantine. But I think that's the other part, is what this ends. And I know so many of us have been so deeply impacted by COVID. The number earlier, almost 800,000 people have passed away because of this pandemic. And this is a powerful opportunity for all of us to move forward from this and an end to that, and to having family members who are ill and pass, and end to thinking about, my relatives who are fatherless children at this point. And so I'm excited about what this has the opportunity to expand, but also the opportunity to end some of the worst things that we've seen of the pandemic. So I'm excited as a Board of Education member, but first and foremost as a parent, to get my kids vaccinated, and really encourage everyone else to get their kids vaccinated as soon as possible. Thank you so much. And I'll have Dr. Luna come up now.
Thank you. Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les voy a hacer estas actualizaciones en español, un idioma que tú entiendes y una cultura que te representa. La ciudad de Chicago está redoblando sus esfuerzos para vacunar a todos los habitantes de Chicago luego de la aprobación federal y las recomendaciones finales del CDC de la semana pasada, que permiten que todos los niños de 5 a 11 años reciban la vacuna de Pfizer. Nos reunimos aquí hoy para hablar sobre la vacuna del COVID-19 que salva vidas y alentar a todos a proteger su salud este viernes día 12 de noviembre y recibir su vacuna en familia. La única forma de superar esta crisis es seguir trabajando juntos para protegernos unos a otros. Es por eso que muchas agencias y departamentos de la ciudad nos han ayudado a lograr esta misión. Se encuentran representadas aquí y muchas más en la comunidad y están reuniendo muchos recursos para el Día de la Concientización sobre la vacuna. Vamos a tener recursos para que los padres se puedan ir en familia y vacunar a sus niños, y esas interacciones que necesitan basada en ciencia y arte para estimular las experiencias de los niños y, lo más importante, dar la oportunidad a todos de recibir su vacuna, bajando y disminuyendo y quitando barreras que puedan tener para recibirla. El viernes 12 de noviembre, las escuelas públicas de Chicago están cerradas por el Día de la Concientización sobre la vacuna, y los empleados de la ciudad recibirán 2 horas de licencia pagada para recibir las vacunas del COVID-19 para ellos y sus familias. Las vacunas son seguras, efectivas y la mejor manera de proteger nuestras comunidades del COVID-19. Estamos entusiasmados con el refuerzo de toda la ciudad el viernes para ayudar a nuestros niños a vacunarse y a los padres elegibles a recibir sus dosis de refuerzo, haciendo que nuestras escuelas sean entornos de enseñanza y aprendizaje más seguros para el personal, los estudiantes y toda la familia. Espero que nuestras familias de CPS utilicen el día de la concientización sobre la vacuna como una oportunidad para llevar a sus hijos al pediatra, a la farmacia local, a uno de los proveedores de salud escolares comunitarios para protegerlos contra el COVID-19. Además de comunicarse con su proveedor de atención médica o farmacia local, visite chi.gov/covidvax para obtener sitios de vacunación adicionales para jóvenes. Todos los niños de 5 a 11 años serán elegibles para recibir $100, escúchenlo bien, $100 en tarjetas de regalo Visa. Tarjetas de regalo por 50 por cada dosis o 100 por Johnson & Johnson cuando reciben la vacuna en eventos o clínicas del CDPH. Las dosis de refuerzo no califican para incentivos. Todas las vacunas de COVID-19 son gratuitas. No se requiere seguro ni identificación gubernamental. Obtenga más información sobre la vacuna del COVID-19 y encuentre vacunas para su familia en chicago.gov/covidvax. También las escuelas CPS ofrecerán estos incentivos. Así que muchas gracias. Le devuelvo a Dr. Arwood para preguntas.
And you want to go first? Yep. Please identify yourself.
Okay. Hi, Dr. Ward. I have two questions for you and two questions for CEO Martinez. First one, if we're paying $50 a kid to get the shot, $50 a shot, that was brought out last week for 5 to 11-year-olds, why don't we do it for the flu, which has a slightly higher or equal mortality rate?
So the incentives are being made available with federal funding specifically for this purpose. And although we obviously want children to get vaccinated for flu as well. Really, COVID at this point, particularly where we look at the ability for children to be able to spread COVID and be, inadvertent vectors for other family members, really the primary focus in terms of the financial incentives are on people of any age, to be clear, getting their first or second doses. So it's not just that it's incentives, available for 5 to 11-year-olds, but right upstairs at City Hall today, we had a City of Chicago employee-focused clinic. Hundreds of people coming out to get vaccine, actually exceeded capacity, which is a problem I would love to see again, and we will address. And there were people getting their first doses of vaccine and getting incentives, on the spot there as well. So it's not that it's particularly for kids, but it's been a focus to encourage people to get their first and second doses of vaccine.
Okay, and what metrics need to be in place in order to drop the mask mandate for Chicago public schools? And are we going to have the masks on because of the flu season? Or will this be addressed after? Because somebody keeps calling into our station saying that, no, she said she's not going to drop the mask mandate until we get through the flu season. So can you just straighten that out for us?
No, I would be happy to. We have seen that masks certainly help with the transmission of flu. That was an indirect effect of wearing the mask through last flu season, but we will not have masks on because of flu. The masks are related to COVID. The most important thing, of course, is getting vaccinated. I would love to be in a place where, for example, fully vaccinated settings, we could potentially drop the mask. This is a conversation we've been having with the state, et cetera. Schools, do offer particular vulnerabilities. If there are younger children still who have not had the opportunity to be vaccinated, that'll be something we'll be looking at. My expectation is schools would probably be one of the last places, honestly, that we would not have masks in place. But if we can get to a point where schools are 100% vaccinated, that would be the setting I would be particularly interested in.
And I'm not being disrespectful, but we weren't in school during flu season last year.
Right?
We didn't. We went to school after, in the springtime, for Chicago public schools.
So what's your
I'm saying
question?
we didn't have a flu season last year because we weren't in school. So how can we compare the flu to COVID?
Okay, so yeah, I mean, we didn't have a lot of flu for the whole host of things that we were doing. We were staying home, we were washing our hands more, we were masking, etc. But what we've already seen this year is that a lot of the respiratory virus, it wasn't just flu. We didn't see all of the respiratory viruses that children typically get, at very, very low levels during the height of COVID. But they have come back sort of with aggression already this fall. We've seen respiratory syncytial virus and others, and so. The mask decisions are focused on COVID. I don't see us getting into a place where we start saying we have to wear masks around, other diseases. Certainly, we want kids to get their flu vaccines, of course. But really, it's about the pandemic, and it's about this really unprecedented for 100 years level of disease that we've been seeing, and using the tools that are available. So, I want to drop masks as much as the next person does. We get below that 200 case mark, they're not in place. But schools, I think, are one of the more sensitive places. So I think, getting vaccinated is step one. It's getting us past COVID, and we'll keep looking at it. But yeah, I'm not having any vaccine requirement in place for anything besides COVID, and we have continued to hold to those same metrics.
Thank you so much. Dr. Martinez, can I ask you 2 quick questions? How many CPS students are in quarantine right now, and have you implemented the Test to Stay program? Because I know some schools have and some schools haven't.
Yeah, on our website, you'll see about over 4,800. Today, we're closer to 3,600. We will be ramping up, we'll be piloting our Test to Stay by the end of the month. So right now, we're actually putting a team that's going to be dedicated specifically to that. And one of the biggest components is personal phone calls to the families. And so by the end of the month, it will be up and running.
Okay, and last question. A lot of parents thought the Vaccination Awareness Day was in place or put in place because CPS doesn't have enough substitute teachers because we're off Thursday for Veterans Day, but then back one day, and that they wanted, a lot of people already called out sick. Is there any truth to that?
So we've looked at the data, and the number of substitutes we were going to need for this Friday, the 12th, would have been about this comparable to other Fridays. But because we had a Thursday holiday, we knew that we needed to incentivize more to just get more substitutes. And what we've seen before we canceled classes, that we were going to have enough substitutes to be able to have coverage that is at least comparable to other Fridays. We still have, frankly, a shortage, and this is nationwide, for substitutes. But in terms of the actual incentives that we actually put in place, we're actually going to work. And in fact, I know this because we decided to honor our substitutes to actually pay them for that day, even though we canceled classes.
Dr. Martinez, if you don't mind, just another question or two for you. John Garcia with Channel 7. Can you talk just a little bit more? You obviously touched on it, but in terms of the importance of justification, I guess, in terms of a day without classes and the reason for doing this, obviously.
Yes, and so, I lived through COVID. I mean, all of us did, but I lived through COVID, firsthand as a superintendent in San Antonio in Texas last year, and our schools were open. And after the holidays, we saw some of the biggest spikes. And to compound that, one of the things that we've always had in safety procedures here in our district, and I had it in San Antonio, is that when any child has any symptoms, we have to pull them out of class. And then the child has to get tested before they can return. When I started looking at, with 330,000 children, colds, and by the way, San Antonio doesn't have a winter like Chicago. So we have a flu season coming, a cold season coming. And when I started seeing the dates, because again, when we looked at the fact that for a child to be fully vaccinated 2 weeks out, really it's this weekend is the magic time to try to be able to try to accomplish that. That's what really drove our decision. I know it's a hardship for families. I am a parent myself. It is something, like I said, that I'm very protective of our families. But when I saw the risks of what could happen this next semester, and it is a concern I have, even though we're just seeing a small uptick in cases right now, again, we're not even seeing the colder weather yet coming. We haven't seen yet the holidays. And so, I will continue to say this. This is an investment for the rest of the school year. I want to have stability in our second semester. I want to make sure that we're not quarantined, even with a test to stay in place. If the holidays come in and we see a significant rise in cases, we're going to wind up quarantining, many students, and we're going to lose even more instruction. So that's the goal. What we're going to learn that day is how many families took advantage. I am hopeful because we're hearing from different providers that they're seeing quite a bit of families signing up. I want to be able to help those families around the second shot because there's actually some flexibility, and I'm not the expert, but Dr. Awadi and our health professionals, there's a little bit of flexibility in the 3-week period. So we can work leveraging our resources, our community resources, and so if we can get them fully vaccinated, and then we'll also know who hasn't had the shot, who hasn't started. And I think there we have to go down a different path of how do we get those families to feel comfortable.
Can I just add one thing to that, if you don't mind? I really don't want to see families fall into the I'm going to wait and see trap here, which I am a little concerned about. Right now, cases are already increasing. That is not unexpected, given the weather, given what we're seeing around us. And we know what an impact having unvaccinated children in schools has had. Of course, the first reason we vaccinate is to protect the health of students and their families. But when students are fully vaccinated, they are not required to quarantine from school, from any other setting, just like an adult. And so if we can get a lot of students vaccinated now, if we can get a lot of adults vaccinated and boosted ahead of the holidays, right now is the time to do that. We wait a month, we wait 2 months, we could be in the middle of a larger surge. It's too late to really be doubling down at that point, though of course we will do it. And so really wanted to take the opportunity that we're ahead of the holidays, we're ahead of a number of companies' end of the year requirements around vaccination. Of course, City of Chicago employees also needing to get vaccinated and wanting to make sure we were making time available for those employees. Right now is the moment to do that. And so, in these vaccine trials, this vaccine was safe and it was effective for young children. It cut the risk of COVID by 91% in the 5 to 11-year-olds. There were no serious side effects, no cases of myocarditis or pericarditis. The dose is lower, the vaccine is safe, it's effective, and we really, really want families, kids, and adults to step up and get it right now before we're in the middle of a big surge.
Can I just ask you, Dr. Arwady, to clarify? I just want to make sure my numbers were correct. 210,000 5 to 11-year-olds in the city of Chicago?
That's correct.
And the number of pediatric doses that we have ordered at this point, was that about 100,000?
About 100,000, exactly. So I would love to have given 100,000 by the 12th. I think that's unlikely, but it would be great to see. The point is we have plenty of vaccine, and we're also monitoring actually pretty closely where vaccines are being signed up for. We're adding doses where we need to. We may add sites. We're in a lot of close communication with providers. So again, really encourage people, if they're able to make that appointment, because it lets us make sure that there is vaccine available. But there's been a lot of work going into this, and there is absolutely vaccine available. We just want you to start with your own pediatrician's office. That's the best place always, and then sort of go from there in terms of the pharmacies and what else is available. So it's a lot of work. You can see, a lot of the agencies here have really stepped up to promote vaccine, to make sure that, kids are covered on that day. We didn't have a chance to mention there's also more than 100 sites that will have food available for children, who may need nutrition support on Friday. So we've tried to be thoughtful and careful about this, but now is absolutely the time.
Thank you so much.
Mm-hmm. Mauricio Pena with Chalkbeat. I was wondering how many pediatric vaccines is the city going to dispense on Friday, and of those, how many will be distributed at CPS's 4 regional sites and mobile clinics?
Okay, so the way that this works is, again, we have been distributing to providers across the city. Every single pediatric provider in the city of Chicago who wants vaccine can get vaccine. It's just that some of the smaller ones may get, a smaller number of doses right at the beginning. So what we're really doing in advance of Friday is looking to see what kind of sign up are we seeing. I know there's been a lot of interest in sort of what's happening at the school sites, and certainly we're interested in that, but I'll tell you, that's actually not where you look across the country and you look at best practices around vaccine. We see much better more uptake actually in providers and in sort of community spaces, and really the schools serve more of a role for after that initial big surge of vaccines. So, I talked to other large cities around the country that said, let's try to do a clinic at every school, for example, actually saw very, very low uptake in that setting. We think it's much more important, and what you've heard is really at not just CPS, but the other schools, we see where do we have a lot of room to go. CDPH, for example, already started calling down the list of some of the CPS high schools that were least vaccinated among students. Have those individual conversations, work with the school, get the meetings together, and then do these school-focused vaccination events after that larger surge of vaccine. So I can tell you, we get the vaccine numbers in every single day. Just in the first few days of vaccine, we had more than 6,000 5 to 11-year-olds get vaccinated, and that was at a whole range of pharmacies, hospitals, pediatric providers, outpatient providers, and some of the mobile sites. So it's working exactly as we would expect it to. We did add some additional doses to the CPS 4 regional sites already, and none of them are full right now, I will tell you, in terms of vaccine numbers. Should we see them fulfill, that would be the sort of thing that we would think about putting additional doses there and or standing up additional sites as needed. We just want people to sign up and get it done.
Do you have an estimate as to how many pediatric vaccines you guys anticipate being distributed on Friday?
So they're not distributed on Friday. They're all we will have 100,000. I think it's like 98,900. It's about almost 100,000 vaccines distributed and in place by Friday. So it's not that there are a few settings where we're doing larger clinics where we're sending additional vaccine, but this is really about, and there's division, Walgreens is getting 15,000. There's different sort of amounts within it. But again, we're sort of watching to see where are we seeing folks signing up, and then putting always extra emphasis on communities that have been hit hardest, where there have been more barriers. And then you heard we'll be using the schools, but then also, for example, we'll be opening up our at-home programming, which is really, very unique here in Chicago. Once we get through that first really big push, I'd love to get as many people as we can done this Friday, this Saturday, this Sunday. We'll see where we are after that point, and then, just as we've done all along, use that data to continue to push events and build that confidence.
Gotcha. And a question for you, Dr. Martinez. We've been hearing from a lot of parents that have been concerned. I know that you guys have been working with different agencies to kind of make up childcare for Friday. Were parents consulted ahead of the canceling of classes? If so, in what capacity?
No, I mean, this was really a decision that we made really as an investment for the rest of the school year. And I know it is a hardship for parents, and I'm so grateful to the city agencies, our faith-based community that are really helping us with this. It was really the weighing of, and I know it's a struggle for November 12th, but really as I looked at the whole rest of the school year, the fact that we're still quarantining children right now, and we reduce it from 14 to 10 days, and with the risks that I see coming with the holidays, with the potential risk of cases that have risen in the past. I mean, this will be, every year is new because we have vaccines available now, but those risks, that's what really drove our decision more than anything else. And so, I'm hopeful. I'm hopeful because, again, I'm hearing a lot of positive activity of parents signing up their children for vaccines. My own children are going to be vaccinated on Friday. I'm going to get my booster on Friday. So again, for me, I wanted, and I've encouraged all of my staff to get their, because so many of our staff are parents in CPS as well, so that they get their children vaccinated. So this is a movement, hopefully, and again, this is, and with this one, we wouldn't have been able to do this without Dr. Arwady, without the support of the mayor and the agencies. This is really a truly citywide effort.
Thanks, everyone. Thank you very much.